regulated, heavily subsidized markets for health insurance that you'll find in the Swiss and Dutch systems. Where we innovate in the United States in terms of socialized medicine or government control of healthcare finance is the Medicare program, which covers about 66 million people. The national government runs it entirely. It is the largest purchaser of medical goods and services in the world. And it is a monument to centralized economic planning. Some people in the United States, about 4% of the population, have both our version of the Canadian the Canadian health system and the U.S. Medicare system. And then, of course, as I mentioned before, you have millions of people, about 8% of the population, who don't have health insurance. All of these different government interventions to try to make health insurance more universal haven't achieved universal health insurance, but they do give the government a tremendous amount of control over healthcare in the United States. So much control that when the OECD measures how much of the spending government controls in each nation, the United States is near the top at 85%. Government controls 85% of health spending in the United States. That's just 2 percentage points away from the country where government has the most control, which is Germany. It puts the United States in a statistical dead heat with France and Czechia and Denmark and Norway, all of which have universal systems, and government has more control over health spending in the United States than in Great Britain, Slovakia, Austria, Poland, where government only controls 75% of the spending, and Canada, where it controls only 71%. So far from a free market, the US health sector is dominated by government control. What does the government do with all of that? Well, this slide is provides more indirect evidence of how much control government has over healthcare, and also suggests what government in the United States tries to do with all of that control. These are lobbying expenditures, the amount of money that different industries spend lobbying Congress. And what you'll see is, you may have heard of the US Department of Defense, the US military, maybe you've seen their work. A lot of people make a lot of money providing weapons and other things to the US military, but spending by defense contractors is only about $136 million per year. The healthcare industry spends nearly 6 times that amount lobbying Congress, or did in 2023, and they have led all other industries in terms of lobbying expenditures for the past 20 years. Government has so much control over their incomes that they think it's worthwhile for them to spend that kind of money lobbying the US Congress. And what do they lobby for? Well, they lobby for more. They lobby for greater subsidies, higher prices that the government pays them, and to reduce and to expand health insurance coverage, or reduce the amount of healthcare that consumers pay for out of pocket. Because when consumers are paying for healthcare through insurance, they don't care about prices, and they will consume a lot more medical care, which enriches the industry. Well, you'll see what this graph shows is that over the last 60 or more years, the share of health spending in the United States that is out of pocket, it comes from the consumer and goes straight to the provider, has been falling from nearly 50% and is now down around 11%. And at the same time that happened, consumers became less price sensitive. Healthcare providers have been raising prices dramatically. These 2 lines, the blue line and the orange line, show what has happened to real prices for medical goods and services over that same time period. They have risen dramatically above and beyond the overall rate of inflation. If they only rose at the same rate of inflation as inflation or general prices, those 2 lines would be flat along the x-axis. Instead, we see dramatic price growth, in large part because of the fact that consumers are less price sensitive. They're not going to shop around for lower prices. They resist when their insurance company or the government tries to negotiate lower prices if that means they don't get the drug or get to go to the doctor or hospital they want. And while this is not direct evidence of that more comprehensive health insurance leads to higher prices, correlation is not causation, Here's some evidence it's a little more direct. When Congress required all health insurance plans in the United States to cover contraceptives at 100%, so the consumer would pay nothing out of pocket, prices for this orange line, prices for hormones and oral contraceptives, which had been falling relative to inflation before that mandate took effect, began rising and rose so dramatically after consumers were completely price insensitive that prices doubled over a 9-year period, prices for hormones and oral contraceptives. And so it shouldn't surprise us that in the United States, prices are 43% higher than the OECD, than healthcare prices, the average for healthcare prices across the OECD. And this is not a function of free markets or how free markets operate in healthcare. It is how the US government engages or intervenes in healthcare in an extremely robust way. It does so in ways that increase prices. And in fact, it has intervened to expand health insurance coverage for those who have health insurance to such a great extent that in the United States, the share of healthcare spending that is out of pocket, at just 11%, is among the lowest among OECD nations. It is a lower share of health spending than in Denmark, the United Kingdom, Canada, or Poland. In all of those countries, consumers are less heavily insured in the sense that on average they pay for a smaller share of their medical care out of pocket. So the same thing happens with the quantity of care that people consume. This graph shows that same trend in out-of-pocket spending against real per capita health spending, which is prices times quantity. It has also grown over that 60-year period at a very robust rate to the point where patients in the United States, or the average person in the United States, consumes 49% more services. So independent of prices, we consume 49% more services than the average patient in the average OECD nation. Again, in large part because of how heavily government intervenes in healthcare in the United States. And so when people ask, this graph shows healthcare spending as a share of GDP across OECD nations, but divides it into voluntary versus compulsory spending. And what it shows is that while total healthcare spending in the United States consumes about 16.6% of GDP, compulsory health spending alone accounts for 14 percentage points of that total. That's an interesting number because it means that compulsory health spending in the United States consumes a larger share of GDP than total health spending in every other OECD nation. And that's about twice as much as total health spending here in Poland. As a share of GDP, it's about 7% or a little less here in Poland. So if people ask why does the United States health sector spend so much, or why does the US economy spend so much on healthcare, the answer is not free markets. The answer is that government compels people to spend that much. There are other indicia that suggest that the United States relies on free markets in healthcare less than other nations do. This graph shows the regulatory barriers that governments in different countries pose or put in the way of consumers who want to access certain medications. And it shows that those barriers are as high in the United States as they are in Italy and Netherlands, and higher than they are in Australia and the United Kingdom. There are fewer regulatory barriers, or consumers there face fewer and less burdensome regulatory barriers when they want to access the 86 pharmaceuticals that this study examined. One that particularly sticks in my craw is the regulatory barriers the government puts in the way of women who want to access oral contraceptives. In the United States, you need to get permission from someone the government designates, i.e. a physician, to provide you a prescription in order to purchase daily use oral contraceptives. You'll see that in most of Europe and a few South African countries, Australia and some others, governments also impose those same barriers. But in more than 100 countries around the world, women have more freedom to access daily use oral contraceptives than they do in the United States. You might think that, well, if it's the United States and Western Europe, these must be the enlightened nations, so that must be the enlightened thing to do. But don't forget, Saudi Arabia also requires women to obtain to obtain a prescription permission slip from a government-appointed gatekeeper before purchasing oral contraceptives. And so that's a nation that is not known for having a progressive attitude toward women and women's rights. So while the government, but now I want to talk a little bit about the lessons that we can find in the US health sector for other nations. While government does intervene very heavily in these and other ways in the US health sector, there are sometimes within or between these interventions room for market forces to breathe just a little. And when they do, they produce remarkable things. They produce lower prices, and they produce higher quality health insurance and medical care. And so I want to talk about a couple of innovations that happened, one within the employer market, another within the old individual market in the United States, and one that happened across both that show the promise of free markets if you will just give market forces enough room to work. Employers who are having a hard time getting prices for things like hip and knee replacements down struck upon an innovative new health insurance design that captured or that took advantage of consumers' natural price sensitivity and the fact that they will change their behavior if they see the savings. That just a fundamental market mechanism, cost-conscious consumers, that often it's lost when you have patients who are as heavily insured as they are in the United States. But this employer, working with an insurance company, designed their health insurance in a way to make their enrollees more price sensitive. And when they did, they saw something remarkable. Their enrollees were able to spark price competition among healthcare providers, hospitals, lab companies, radiologists, and so forth, and surgeons, that drove prices down lower than the insurers were able to negotiate those prices themselves. Prices for hip and knee replacements at high-priced hospitals in these experiments fell 37% over a 2-year period, a very short time period, and no one had to go without a hip or knee replacement or any medical care at all. Just by making the patient more price sensitive, they were able to get the prices down, and that shows that when consumers control the money and see the savings, they will spark price competition among producers and drive prices downward. And if you want universal health care, this is how that happens. Falling prices are what make healthcare and everything else more universal. The reason we're able to keep 8 billion people alive on the planet right now is not because of a universal food program. It's because innovations in food production and distribution have driven the price of food down lower than they've ever been in history. We need to do the same thing with healthcare. Also in the United States, we've seen innovators develop, just as a matter of course, health plans that make healthcare more convenient for patients and improve the quality of care, the technical quality of care, through the use of electronic health records. We call these plans Kaiser integrated prepaid group plans. In the United States, there's really only one of them. It's Kaiser Permanente. The reason there's only one is because the regulatory and other barriers to these sorts of plans are so high that it was very hard for even one of them to break through. But what Kaiser does is it uses its electronic health records to make care more convenient for the patient and has even used them to identify unsafe drugs faster than the FDA did, faster than the federal government did, thereby improving quality. And these plans improve quality on lots of other dimensions as well. But what happens with these plans is similar to what happens to plans that try to innovate with these sorts of price-reducing insurance designs. The government penalizes the plans that implement these sorts of designs, and it imposes regulations that block plans like Kaiser Permanente, and it penalizes them through the tax code, and it heavily subsidizes the competition. Insurers have also developed health insurance products that make health insurance more affordable and higher quality than the insurance that the federal government designs through the Affordable Care Act or Obamacare. There's a health care market, or health insurance market in the United States that is exempt from Obamacare, and in that market, insurers have offered comprehensive health insurance at premiums that are 60% lower than the lowest cost Obamacare plans. We should be heralding this as a wonderful success of free markets and market competition, because falling premiums, like falling medical prices, make health insurance more universal, but instead, the government outlawed these plans. Similar plans have made access to health care more secure for people with high-cost conditions through an innovation called renewal guarantees. What this graph shows is that prior to the implementation of Obamacare, relatively free health insurance markets were providing more secure access to care for the sick than employer-sponsored insurance, the kind of insurance that government compels 90% of people in the United States with private insurance to enroll in. And the guaranteed renewable individual market plans were so innovative that they even developed products that would fill in the gaps in employer-sponsored insurance. And make access to healthcare more secure for these people in the employer plans who lost their coverage after losing their jobs. The government should have been heralding this as a tremendous success. Instead, the government outlawed these innovations as well. Now, there is room for hope in the United States, and I think across the world as well. Another lesson from the United States is reform is possible. Many states have begun reforming the regulations that have blocked the sorts of innovations that I've been discussing. About 20 states have implemented reforms that would deregulate occupational licensing. Not all of them apply those regulations to the health professions, but some of them, including Arizona, do. These remove regulatory barriers to entry into the markets for medical services, and therefore not only open the door to better and more affordable medical care, but also better and more affordable health plans as well. There are still opportunities in the United States for markets to make health insurance more affordable than the federal government does through Obamacare. The Obama administration exempted health insurance in U.S. territories like the Virgin Islands from Obamacare's costliest regulations. In Florida, legislators have introduced legislation that would allow their residents to purchase health insurance from U.S. territories like the Virgin Islands, which means they too could get insurance that is maybe 60% less expensive than the lowest cost Obamacare plans. And finally, the employer-sponsored health insurance market in the United States, which covers more than 1/2 of the U.S. population, is a compulsory health insurance system where the government penalizes workers unless they let their employers control a huge chunk of their income. $17,000 for people with family coverage, and then use that to choose the workers' health insurance, and lousy health insurance that disappears for no good reason when you leave an employer. As a result of that feature of the tax code that creates that compulsion, employers get to control $1 trillion of their workers' earnings every year. But there have been reforms in the United States that have given workers control of just a small amount of that money, just 4% of that $1 trillion. Those reforms we call tax-free health savings accounts have not had a dramatic effect on consumer or worker control of their health insurance dollars, but they are a step in the right direction and a platform on which we can build to give workers control over all of their health insurance spending, which would reduce the amount of compulsory health insurance spending, or at least give workers more control over how they spend their healthcare dollars, and force the healthcare sector to respond to their needs rather than the needs of government and employers by providing better and more affordable and more universal healthcare. So I thank you very much. I look forward to hearing from the other panelists and from the audience.
Thank you very much, Michael. There is one information that you didn't provide us the answer to. The life expectancy in the US is more than 77.5 years. old. So, and the average in the OECD country is more than 80 years old. So who is to blame for that phenomenon? Like, what's the reason that the American system is behind the developed OECD countries?
I'm not sure that life expectancy is a fair measure of health system performance, because there are so many factors that contribute to life expectancy beyond how the health sector performs. There are there are factors over which neither the health sector nor the individual patient has control, like genetic factors. There are choices that the patient makes or the individual makes over the course of his or her life that will affect life expectancy, like diet or exercise or risky activities like smoking and drinking alcohol and drug use and sexual activity and so forth. And all of that said, there is still, there's this persistent problem in the United States where not only life expectancy, but other measures of population health, like mortality from diseases amenable to treatment or to prevention, make the United States look pretty bad by comparison. And there are a lot of possible reasons for that. One of them is that the U.S. health sector soaks up so much national income, so many resources, that and spends a lot of those resources on low-value care that does not improve health or that even harms health, and then prevents consumers, or therefore prevents consumers from spending that money on other forms of consumption that could improve health more than the marginal dollar of health spending. Expenditures like on nutrition or better housing or education, all of which can have a causal impact on health outcomes. Yeah, and there is one more response to that question, which is there's a confounding factor that is directly related to the U.S. health sector that makes those comparisons very tricky. And that is that if the U.S. health sector does one thing well, it has produced new medical innovations. Most of the world's new medical innovations, new diagnostic tests, new treatments, new cures, don't just, the United States develops most of them, and then they don't just stay in the United States. They go all around the world and begin saving lives everywhere. Sovaldi is a 95% cure for hepatitis C. The United States developed it, but it's not staying in the United States. It's saving lives everywhere. So the United States health sector is making healthcare more universal all around the world and improving health outcomes in other nations, while absorbing criticism because it spends all that money to produce all those. Yeah,
you are totally correct. But isn't like the answer that the private business don't spend its money on prevention? Like, you know, in a state control system, like in Europe, governments are invest money on in the healthcare system on prevention, like to not pay for the patients who will be in the hospitals. They figure out that it's cheaper to, you know, warning people about their bad behaviors when it comes to their health. So isn't like weaknesses in the American system that there is no one who is interested in prevention?
I am not sure that other nations do a better job at prevention, but I know that the United States does not do a good job there. And the reason there relates to a lot of the government interventions that I mentioned. When government makes employer-sponsored health insurance compulsory, it eliminates or vastly reduces the incentive of insurance companies to invest in preventive care that would avoid illnesses and medical expenses over the long term, because the insurance company doesn't have a lifelong relationship with the patient and doesn't know that it will get to see the payoff from those investments. The payoff might go to one of its competitors, because in the United States, workers change jobs about 12 times by the age of 52. So if I'm an insurance company, why would I make those long-term investments? Similarly, the type of health plans that have the greatest incentive to invest in preventive care are the Kaiser Permanente type plans. And those have faced more regulatory barriers than any other plan in the United States. And the tax code penalizes those plans. And the government subsidizes other models heavily. And so I'm open, perfectly open to the possibility that a lack of preventive care is contributing to a below average life expectancy in the United States. I think there are probably other factors at play as well.
We are a little bit more familiar with the American healthcare system. I would like to ask Dr. Jacek Gleba about the lessons from the other country. Dr. Gleba is a manager in, he owns actually a private clinical facilities in Poland, so, which are actually working differently to the how usually those facilities work here in our country. So what are the other lessons for the good manager, for the good public policy in the healthcare system? Who are the best, which are the best countries that we should learn from?
Thank you. I think we widely simplify the problem, telling only about who is paying for the medical service. Because the payer is the payer, but I think, in my opinion, is that the most important thing is how the service is organized. And we see it very clearly in Europe. We have different countries. Each country works more or less, it has been shown, with balance between public and private payers. But I know there's three of these countries, UK, Spain and Poland. And in each one of them, the service is working different. And the consequence of this is very, very important for the patient and for the effectivity of this expenditure in health. For example, in Poland we have like a specialized based medical service. So specialist is very important, lower in the service. In different countries, we have, in other countries, in Europe, USA, I think, also the same. The paper of GGP is much more important. So GP is diagnosing the problem, is focusing the problem, is organizing healthcare for the patient. In Poland, we have like a service organized by a specialist, so we send the patient for different specialists. In fact, what we have done in Poland as our clinic, we have reduced the time that we need for the diagnosis of the patient. For example, we can do, I don't know, cancer diagnosis 2-3 weeks, but the normal public service needs 6 months and the private sector needs 2 months. The reflection what we need to have, I think, in Poland is just to think how we spend this money how we organize the service. So we can't only tell, okay, it's private or public. In Poland, it's widely the same. If we go to the private or the public, the system is working very, very similar way. Nothing changed. And we just try with our clinic to do it in Warsaw different. So we organize all the service different than everybody. Everybody was telling it's not going to work in Poland because the patient wants different things. It's not true. The patient wants to be treated quickly, rapidly, to get healthy and no problem with the service. So we just try to avoid it with the same price, with the same expenditure as everyone. So in consequence, for example, comparing as this, if you have a patient who is diagnosed for cancer in 2 weeks or 3 weeks, you can treat them very early in the first stage of the illness. You don't need to wait 2 or 6 months to get an answer for the problem. So I think not only money, not only the payer. And I think in Poland we have money, as you have seen on the graphic, we have quite a lot of money, but we don't spend it correctly because the service is not organized.
Łukasz Jasiński, if you had an opportunity to reform the Polish healthcare system, how would you do that?
I would like to privatize it, of course.
Fully, totally, and left that to the
Yes,
free market with no regulations from the
maybe
government?
it shouldn't be a revolution, maybe better ways step by step. And why? Because as Michael showed on one page, if we have, for instance, very positive role of direct payments, creates natural pressure for suppliers to reduce the costs, because I pay from my own pocket, not by insurer, no matter private or public insurer, and this creates more competition on market, because and more competition means lowering costs. So medical services are more affordability, they are more available for poor and poorer patients, and we should rely on what I called. Okay, maybe at the beginning, because if we're comparing private health systems to public, we shouldn't rely only on comparing public insurance to private insurance, because what is the difference between these two systems is that market solutions, market health system, has its own significant natural market structure of financing access to medical care services. So there is a market insurance, market system. There is a place for insurance, private insurance. There is a place for direct payments, medical subscriptions, and charitable organizations. And this all elements creates private solutions and creates private solution and market health system. And it depends, because we should also remember that idea of insurance is very attractive, but insurance wasn't designed to cover everybody and to cover any risk, because some risks are uninsurable, because we can't make an economic calculation. We have no numbers. We can't estimate how large, how small or lower should be insurance premium. Some people have pre-existing conditions and difficult to cover them, especially if they have rare illness, and it is difficult, but it isn't proof that it is some kind proof for market failures.
Yeah, but this is difficult. So who's gonna take that part of the market? Like, if no private company is gonna insure those people, and no private facility will take those people. So it shouldn't be any part of the public medical system, healthcare system in general.
I think we have a market alternative, charitable organizations, and if more we have market-oriented economy in overall, then most important role they are playing.
So, Michael, in America, would like a private charitable hospital take unemployed, homeless person and is gonna provide them like a high-cost cancer healing treatment? Or is it like the utopia, libertarian utopia that charity is going to take all the job when it comes to the treatment?
Are we talking libertarian utopia? Okay, let's talk about that, because that's not the United States, as I tried to clarify earlier. But let's talk about what a libertarian utopia would look like and how it would look different from what we have in the United States right now, and then maybe what we have in Poland. It would look very different from what we have in the United States, because in the United States, the government has intervened in healthcare in ways that make the problem you identified much, much worse. So free markets in health insurance drive down the price of health insurance so that it becomes more affordable for more people. And the fact that your premiums will go up if you wait until you get sick to buy it creates a huge incentive for people to buy insurance before they get sick. So they insure, and they're paying their premiums, and they're helping pay the medical bills of others who get sick, complete strangers, which makes voluntary health insurance one of the most compassionate things that humans have ever invented. And then, once they get sick, it provides them secure health insurance over time. Perfect health insurance? No, not. But more secure than what government came up with employer-sponsored insurance that throws you out of your insurance after you get sick because you lose your job, or you divorce, or your spouse dies, or you turn 26, or you turn 65, all sorts of reasons. Because the government compels people to go to that sort of health insurance and then throws them out afterward, we think, everyone blames that on markets when it's the government's fault. And then everyone thinks that free markets produce this problem of people, tons of millions of people with pre-existing conditions who can't get health insurance, when that wouldn't be a problem, or the problem will not be nearly as big if in that libertarian utopia, because people would be able to get affordable health insurance that would stay with them when they get sick. Their premiums wouldn't go up to because they got sick, And the problem of pre-existing conditions would still be there. There'd still be that unemployed homeless guy. There would still be people who didn't buy health insurance when they should have, and then they got sick and can't afford the medical care that they need. But that problem would be so much smaller than it is right now, and healthcare prices would be so much lower than they are right now in the United States, that any sort of subsidy that we would have to provide for those people would be so much smaller than the subsidies the government in the United States is currently providing, that we might not even notice. And private charity might be able to cover the whole thing. I don't know. I can't predict that. But what I would predict is that even if there are people who would fall through the cracks of that sort of a system because they were unemployed and homeless and got cancer, even if that did happen sometimes, I wonder whether it would, but even if it did, the number of people who would fall through the cracks of that system in that way would be so much smaller than the number of people who are falling through the cracks in the US health sector right now, or I would venture to say the Polish health sector or any other health sector around the world.
Adwosem Jacek Gleba.
Yes, following your opinion, I hardly agree that the privatizing is the best solution for everything. Without seeing the context we are staying in, it's impossible to decide. If I am the patient, I would prefer, hardly prefer, if the payer is the public sector, but organized public sector, and but organized private sector. Because public sector can afford everything. They can pay for whatever they want. The private sector cannot afford any expense for health expense for the patient. So what we are facing with financing, which is ending very, very quickly. So I don't think there is a solution because, okay, we can't speak only about the money. We need to speak about health indicator because the target of the health sector is to get population healthy, to give them health. If we talk about how much it costs, okay, can cost 10, can cost 20, 100, whatever. But it's not the problem. The problem is if you get population healthy or not healthy. And Poland, with quite high expenses in health, if you look at any indicator of health indicator like breast cancer treatment and so on, Poland in Europe is one of the two last countries always. And the health indicator we're in the end of the line, everywhere. So the problem is not only the money. And for me, the discussion if the private or public is not worth too much to do it, because it's not the problem. The problem is how the patient is going through the system, how effectively work. So I will focus it completely different. Who will you pay for? Okay, probably public is necessary. In a European country, we have long tradition that we have strong public sector. If you look at the French or Spanish system, we see very, very good cohabitance of public and private sectors, and they're quite effective. They are like sharing the market between them, covering the places for public they're one place, like one part of the market, for the private is another one. And the patient, they know how to use them, both of them. And normally they use both of them to get quickly to what they want.
So actually, we did reform lots of public areas of activity. So what are the barriers that stop the government for changing the way the Polish healthcare system is organized? So why it's so difficult in the last 30 years after Polish transformation that the minister responsible for the healthcare system didn't manage to do that?
I would ask this question different. Why the private sector doesn't do these things in different way? Because they like copy and paste what the public sector does. Nothing new. They like a public sector plus. Anything more, they want to be quicker, faster, whatever. They pay more, they're more expensive, it's true, but they're not more effective. They don't find any new solution, any new way of doing things.
So now we've got two questions. Why private sector is not so efficient on that matter and did not reform, did not change the system, it just copied the system from the public sector?
In my opinion,
yeah.
They're just not brave enough.
Pardon?
They're just not brave enough. It's just this, nothing more. The things have been always done in the doctor ways. Since 1990s, done this way, and they think, okay, we'll do the same because it's the best way. Doctors want to do this way, they know how to do it, and nobody is trying to change them. This is the only problem at the moment.
Michael?
In the United States, the experience is totally different. Everything that the government tries to do to innovate in healthcare care, whether it is a new way of organizing the delivery of care, a new way of paying providers, either bundled payments or capitation or pay for performance, paying for value, whatever you call it, it's always something that the private sector has already developed. The private sector in the United States, in spite of massive amounts of regulation at both the federal level and the state level, has been remarkably innovative in some of the ways that I've mentioned. And it's amusing to me every time some politician or some government bureaucrat or some a policy scholar says, I've got a great new idea for how the government can innovate. They're just copying what the private sector has already done. But regarding public versus private, I do have a question. Did you say that the public sector, the government sector, can afford things that the private sector cannot?
In many countries in Europe, looks like this. Yes, the private sector is not
So
paying.
where do they get the money?
The public, they have money. 6 euros.
So where does the government get the money to afford the things that the private sector cannot afford?
They have much more money normally.
Well, okay, but now we're getting to the question of what is money? Where do they get the money that they have?
From the people, from the population, from the taxes.
From the people, right? Well, that's the private
taxes.
sector. That's the private sector.
No, private sector, the bank is
The people are the private sector. They're out there, they're earning their money, and the government extracts that money from the private sector and then spends it. So by definition, the government can't afford anything that the private sector can't afford.
Theoretically, yes. But for example, if you look at Spain, it's a country with a very, very huge private sector. Everybody knows, as a patient knows, okay, if you want to, I don't know, to go for this delivery or for anything simple medical problem, you can go to the private sector. If you don't have money, you go to the public sector. But if you have cancer or whatever, a complicated, complex health problem, it's much better if you go to the public sector. What is this? Explain me why.
If you don't have money, or if you do, or
if you don't have money, use the basic services like GPs and whatever in the public sector. Okay. If you have money, the mid class, you go to the private sector for everything what you want, except real important health problems. If you have cancer, you will go to the public hospital. The best centers in Spain, for example, are all public hospitals in this way.
And are the quality metrics better, or are people going to the government hospitals?
In the quality and effectiveness of treatment.
Are the people going to the government hospitals because the quality is better, or because it costs them less because they receive a subsidy?
Because the quality is better.
Why would the quality be better in the government hospital? What do they do differently?
Because they can be investing in investigation, in doctors, in staff, and equipment for
Why
years.
doesn't the private sector make those investments as well? Do people not want them?
No, because it's a focus in different level of the services. They have been used, it's always this history. What have been used to doing for? They used to provide this layer of the services.
What it sounds like you're saying is that the government subsidizes that level of service heavily enough that it doesn't make sense for people to pay for it themselves. Not necessarily that there's anything inherently superior about the quality of care when the government provides it. They're just paying for it, subsidizing it heavily enough that people would move from one to the other.
I don't think so. I don't think so. They were just subsidizing this kind of services.
There's a lot of very expensive private sector cancer care in the United States.
Yeah,
where people don't have the opportunity just to go to the government for it, and so the private sector does provide it.
Maybe it's also a question of the volume, okay? Spain is quite a small country comparing to the States. Okay, for the private clinic to have a good level in cancer treatment, for example, it's a long-term investment for years, a huge amounts of money. Maybe in Spain don't have enough volume for this. Maybe it's different for this reason only. So the public sector is playing a different place in Europe and in States. Okay, we can't do clinic for, I don't know.
That's true.
100 million people because they don't have them.
That's true, but it is an instructive point because in many European countries, you have the option of enrolling in a universal government-run health insurance scheme or buying private health insurance that can supplement it or give you access to private hospitals and treatment when the government system is not adequate. Most people don't have that in the United States. Most people in the United States are in employer-sponsored health insurance because they don't have the option of government-provided health insurance. And where that is the case, you still get cancer care. And it's not the case that this is something that the private sector won't provide.
Yeah. Łukasz Jasiński. So what are the lessons from that conversations between Jacek and Michael? So why do people go to the public sector when they've got a very serious treatment? Why the private sector do not cover that part of the market?
Because there are plenty of regulations which hamper the market. And it's subsidies, tax preferences, regulations on supply side, which hamper the market solutions in healthcare. And I want to admit also, I didn't talk about public-private sector. I talked about market system and government system. And if government regulate more and more and more healthcare, it is interventionist system, not market system. This is the difference, because in government system we could imagine we have plenty of private companies. That's a good example. Private pharmaceutical companies, private health insurance companies, private producers of medical devices, but it isn't a market healthcare system. It's only private suppliers, but over-regulated private suppliers. And this creates a situation that for many people, it's much better to afford to stay in public solutions than in market solutions. This is why. If you have no so much freedom to offer real health insurance without government intervention, I'm not wondering that people prefer to stay. But and of course, how are funded this government health system? By taxes. It's mandatory. Give people the choice, and you will see where money will go.
Michael, so do you allow in any part of the in any just part in those complex healthcare system? Do you allow in your just ideologically? Do you allow any part that the public intervention on the public part that the government should play its role, like the?
Oh, absolutely.
That should subsidize some part of the market.
Well,
somewhere.
subsidize.
I mean, substitute some part
of the market. I think the government has an important role in protecting individual rights in healthcare. The most important thing it should be doing is not violating individual rights in healthcare. I think people do have rights when it comes to their health care. Foremost, they have a right to make their own health decisions. They have the right to choose their course of treatment, who's going to provide them medical advice, what facilities they use, whether and how they pool their health resources with their resources with others to pay for medical care. So a right to choose their health insurance plans. But they also have a right not to have someone harm them or expose them to harm, the risk of which they didn't consent to. And so when a drug company or a physician, a surgeon, harms me through negligence, the government has a role, an important role in providing a medical malpractice system or a products liability system, a tort system, where I can go in order to have the government force that doctor or force that pharmaceutical company to compensate me for the injury that they.
Yeah, but it's more like a civil law, like
that is civil law, yes.
Relations.
But it's a very important. It's a very important role that the government has to play in order to, if we're going to protect individual rights. Because if you can just injure me without consequence, then I'm not free. And when the government does that, even more, when the government does that, when the government has a functioning medical malpractice system, that creates incentives for you to improve the quality of care that you're providing.
Yeah, that's correct.
And so that is a role the government should be playing. Now, what about subsidies? I think the purpose of subsidies is to try to get medical care to people who can't afford it by themselves. And so before we should have any conversation about subsidies, what we want to do is we want to get the prices for medical care down as far as we possibly can so that subsidies are less necessary. And what does that, what the evidence from the United States and elsewhere shows is what does that best is markets. What does that best is respecting the right of the patient to control her own health decisions, to control her health care dollars, to choose her health insurance plan, respecting the rights of entrepreneurs and innovators to enter the market without government barriers, to try to offer people something better than what they have today, lower price health care, higher quality health care, more secure health insurance. And when you do that, you find that the amount of unmet need shrinks and shrinks over time, and so subsidies become less necessary. There's never going to be a perfect health system where everybody gets all of the medical care that could benefit them. So there will still be this question of should government provide subsidies to people? And my answer is we should get to that point first, then have that discussion and have a full discussion over whether the way you want government to intervene would cause more harm than good. If it would cause more harm than good, then no, the government should not do that. And I think when you look at most of the ways people want to intervene to provide subsidies, you'll find they do more harm than good.
I would clarify one thing. I think it's important to understand as the same what you said before. One thing is the government is a payer for the service. Another thing is the government a regulator of a service. Important to understand it normally that if government is paying, government is regulating it extremely. So it's not necessary. So another reflection I think we need important to do is what is the payment for the service, what we need to pay, and how to regulate it. The Polish health sector is extremely regulated, but private and public because they copy one to another mostly. So if I agree with you in some parts that I like private sector, I think it's much more effective, what you said, Michael, also. But if you go to the private with the same regulation as the public, we are driving it to not effective private sector. What I'm mostly afraid in Poland is that we will create not effective private sector, trying to move the money through, but without result because we are not measuring anything in this sector, okay? Normally important, in any country you can find any kind of indicators, health indicator, cancer indicator, so how it works, which hospital is better, which is worse. In Poland, we need to really look very, very careful to find anything about this. We don't talk about indicators about health improvement and so on.
Yeah, we are talking about a lot when it comes in your presentation. There was a lot about the efficiency, about the costs of the system. Actually, we can agree here on that scene that we are in majority we are liberals, but there are some social part of the issue as well. So some people just don't care about those efficiency indicators. They just don't want to see the ill people with open wounds on the streets with no help. They would just feel uncomfortable, and they want the public sector to take responsibility for that part of those margin problems, but it shouldn't be a part of our discussion, our liberal discussion, when we are only talk about the efficiency, costs, and so on, not paying any attention to those soft aspects of that problem.
I think I'm speaking directly to those aspects of the problem, because the farther down you can drive healthcare prices, the less often that is going to happen. The more compassionate a health sector you have, because that makes healthcare more universal.
I'm sorry for interrupting, but there will be still some people that will be out of the system. If the system would be the cheapest you can ever imagine, $1 per month, there will be still many people that wouldn't like to contribute in that. They wouldn't pay even that single dollar. They want just take a free ride on the system.
So if you want to, and I didn't make this part of my previous answer about subsidies, but I'll return to it now. If you do want to subsidize people so that they can afford the medical care that they need, government can do that consistent with free markets in healthcare. What they have to do, however, is they have to subsidize people with cash. And you can give a bigger subsidy to someone who's poor. You can restrict the subsidies only to people with low incomes. You can give a larger subsidy to someone with a higher disease burden. you think they need a larger cash subsidy in order to get the medical care that they need, but give it to them in cash. Because when you have the government purchase health care on their behalf, you create a lot of cracks in the health sector. You move away from universality in ways that people who care about that person on the street don't even pay attention to, because it doesn't bother them as much when people fall through those cracks or die that way. But anytime the government is purchasing healthcare, it is reducing the quality of care, because the only way that you can improve on all dimensions of quality is by having open competition between all different ways of paying for healthcare. Because healthcare is so complex that no one way of paying for it is going to promote all dimensions of quality. It just isn't going to happen. You need a completely open competition between all ways of paying for healthcare, all ways of organizing the delivery of healthcare, and so on, if you want to save as many lives as possible from medical errors or misdiagnoses or preventable hospital infections or what have you. But when the government decides that it will run a universal system, or even just intervene in the ways it has in the United States, in just not totally universal, not totally universal system, then what happens is it ends up subsidizing a lot of low quality care, and people keep falling through the cracks that way year after year after year in ways that they wouldn't if we just subsidize people in cash and let markets improve quality and reduce prices, which they do as a matter of course.
Yeah, it's still, I can agree partly, but isn't like any other, like the Singapore model is often used in Poland as an example of some good merge between public and private sector. Like, there is some part that government play its role, not only about the civic law regulations when it comes to the patient and the medical system, but only how to organize that system, and then putting the private entities into that scheme. Like, is there any other models in the world or in Europe that should be an example or some compromise example when it comes in our discussion?
If I can,
I gave some examples from the United States. They would work rather well in every country, I believe. The Singapore model, if the government isn't crushing them the way it's crushing them in the United States, the Singapore model is very intriguing, because the Singapore model involves compulsory saving for medical care, so that the consumer ends up controlling a lot of the money, and presumably then the system will serve the consumer and the consumer's needs, rather than serve the needs of the special interests that influence how government health systems operate. But there is still a lot of heavy government intervention in the Singapore system, with price controls and government-owned hospitals and this sort of thing, that result in misallocations of resources and also create opportunities for special interests to influence those policies so that they direct resources where the special interests want them to go rather than where the patients want them to go. I don't know which nation has a health sector that is closest to the free market ideal, because no one has ever collected those data. I would like to collect those myself. But I think the Singapore model is an intriguing one and might be closer to that ideal than many other nations are.
Yeah, well, I don't have the data, I don't know the data, but I assume that they've got still, in Singapore, they've got still good indicators when it comes to the...
If I can just a little short comment about Singapore, it's again an example of government healthcare system, but it isn't over-regulated, at least on demand side, because they created this MediSafe, special medical savings account, and it isn't voluntary, but they don't rely only on one health insurance universal coverage. This is the difference. And this is interesting data, because many people now in Poland, we have debate, our government should spend at least 7% of GDP on healthcare. Of course, I'm talking about public spending. I also welcome this very often. Look on Singapore before pandemic, the total spending was around 5% of GDP. Now 6%. It's still less than Poland have, and no one is dying on the street. But it's also true what Michael said, that they have overregulated supply side. There are limitations. There are public universities. If you have a new physician, he must work for at least 5 years at public system, not private. And they have a lot of problems with raising costs of hospital services because it's overregulated. So it isn't market. There are a few interesting solutions, yes, and it's a very liberal country. This is also another factor. But I think we had plenty of market health systems for a public health system occurs. So we're talking about early stage of capitalism. Some also in the United States, so-called fraternal organizations. So some kind of medical subscriptions with average lower premium for every worker, and it costs, if I could remember data, $1 per year, and it was your 1 day payment. So you work for 1 day and you have cover for all year. Of course, according to medical standards 100 years ago. But there was no crisis in private healthcare system there. So why public health system occurred? Because if government wants something to do, they can't do this because it's a force. Yes, it's not a market.
I just to mark one difference, okay, between, because telling a lot about that market, the market can be effective. Yes, in some way it is. In many ways, it's not, and especially in medicine, we'll talk about comparing to the, car market. If I don't have money, I don't buy expensive car, I buy a cheaper one. But in this case, I could be obliged to buy a very, very expensive car and to afford very, very high expenses as a consumer. And it's one point. Another point, we shouldn't lose the overview of the population and the health level of the population. It's also like it's difficult to explain as a market because it's like, wellness of everyone. If we live in the health population, we have less infection, less health problem in general, and so on. And in some way, the state is responsible for this. They should guarantee for the population living in the country a health level, acceptable health level. If we just go to the market, okay, we find effectiveness, maybe it happens the same, okay? If I am a medical company, I find the best business for me. Maybe I will do only one kind of operation, the rest is not important for me. But the government, in this case, should regulate in some way, but not over-regulate the system as is happening in Poland now, because I regulate everything. So some balance between competitiveness and regulation and different players in the market, I think is the most effective way. But how to find this balance is the reflection we need to run in Poland for sure. In state, maybe, I don't know.
And the last question in the end of our discussion. Do you believe that in contemporary world, in contemporary system, when many of people are expecting the bigger role of the government, when we are closing the barriers and the liberal free trade agreements are going to an end and we are starting like a protectionism era, do you believe that there will be like the turn into more market-oriented way to organize the healthcare system? Is there a way back in the United States, or is it possible in Poland to make a reform and changing the directions of the ship into the more market-oriented organized system? It's a question to Michael and Łukasz.
Reform of the U.S. health sector is always very difficult because, as you saw from my presentation, it enriches a lot of very powerful special interests. All these government interventions that we need to reform enrich a lot of very powerful special interests. They take a lot of that money and they plow it into lobbying and campaign contributions to maintain their special privileges and their subsidies and their regulatory protections. And And then, and so it's going to be very difficult to undo all of the government interventions we need to undo if we want to make healthcare as universal as possible. But there's a reason I included those slides at the end. Even with all those barriers in the way, even with all those powerful special interest groups, states are still reforming in the direction of liberalization. There are still opportunities for states to go even further by deregulating health insurance. Congress did take a step toward letting consumers control their healthcare dollars and can take a larger step in that direction if, say, Republicans and Democrats unite and take on the healthcare industry, maybe by realizing that if they do reform healthcare in the right way, it will serve the goals and values of both the Republican and the Democratic Party. It reminds me not of what Winston Churchill said, but what people say Winston Churchill said. I don't know if he ever said it, that the United States will always do the right thing after it's exhausted every alternative. We will definitely reform healthcare in the United States in the direction of liberalization. It is only a question of when, because it's the right thing to do, and only it will make healthcare more universal. So I don't know how long it'll take us to learn that lesson, but I'm optimistic about the long term.
Łukasz, is it possible in, at least in the European Union, when the role of Brussels is becoming bigger and bigger and they want to regulate and interfere in other sectors? So do you believe in that?
Well, it's difficult to believe, but I must say that there is the Austrian theory of interventionism, and this theory tells us that if government continue his impact by regulations, taxes on all economy, on healthcare, then we could imagine that the government can control more economy, more healthcare. And a good example, a terrifying example, Michael will know this very perfectly, is Canada. Because in my opinion, it isn't a theoretical subject, because Canada, in my opinion, has worst healthcare system in developed economies, because in Canada there is no private option, it's illegal. They spend almost 11% of GDP on healthcare, and average waiting time for government-related service, regardless of its type, it's around half year. So it's average. Your waiting time for medical tests, I know, consultation with physicians, surgery, ambulatory tests, no matter, average is 6 months. And still, this is data published by Fraser Institute. Many years ago, they published first publication of this report called "Waiting Your Turn," and they said that it was almost doubled, more than doubled. This waiting times longer, and they spend more and more. And this is why thousands of Canadians go out looking for some alternatives to US, to Europe, to India, to Costa Rica. It's rich country. 11%, almost 11% of GDP. And why? But why this is, in my opinion, this is worst system? Because in Canada there is no private alternative. In Poland, I can complain on the public health system, like in other country. But at least I have some market alternatives: private health insurance, private dental care market, and many others, charitable institutions. There is some space, okay? But in Canada, you can't have it. This is why.
South Africa just passed a law that would create a universal government-run single-payer system and ban private alternatives.
I believe that the moment for the liberal reforms appears when the system is collapsed. And it's collapsing. So it's difficult to say that I'm crossing my fingers for collapsing the healthcare system, because unfortunately it's going to cost people's health. So I believe and I hope the reforms will appear sooner than the collapsing of a healthcare system, not only in Poland but everywhere in the world. Thank you to our panelists, Michael Cannon, Cato Institute, Łukasz Jasiński, University of Curie-Skłodowska in Lublin and Mises Institute, and Jacek Gleba, medical doctor and a manager in medical sector. Thank you very much for very interesting and unfortunately unfinished conversation and the discussion. And thank you to our audience for being with us. Thank you.
Thank you very much. Thank you.